Hello class, hello professor. Today I'm talking about the hypertension. AA was a 16-year-old Persian white male, date of birth 4/04/2019, came to the clinic with his mother. He's a reliable historian. His chief of complaint was, I was told my blood pressure is high during a high school physical. History of present illness. AA is a 16-year-old male. He came to the clinic complaining of blood pressure, which was monitored in 2 separate occasions during the school physical. He denies any dizziness, headache, vision change, or chest pain. Past medical history. AA has no past medical history. His last physical and eye exam was on May 2025. His previous dental visit was in August, and he visits the orthodontist every 6 weeks. He has no history of surgeries or hospitalization. He has no medication, food, or environmental allergy. He's not taking any medication. His vaccinations are up to date, including the HPV vaccine. His flu vaccine was done last September, and he had 2 doses of COVID. Social history. AA is a junior in a high school. He plays in a high school football team, and he also plays acoustic and electric guitar. He denies smoking or drinking alcohol, but he admitted that he used cannabis a few times this summer, and he drinks energy drinks occasionally. He has a girlfriend and he's sexually active. He uses condom during the sex. His diet is mainly protein and some carb. He does not drink any carbonated sodas. He avoids processed food. He spends most of his time playing ball or guitar, and his spare time he likes to play computer games. He's not driving yet. He hasn't got his permit either, but he wears seatbelt when he's in a passenger seat. They have a ring alarm and security system in their home, and he knows that his dad owns gun, but they are locked in his parents' bedroom. Family history. His only child, lives in a single family home with his parents. His mother has a 47, and she has a history of hyperlipidemia. Father is 62, and he has a history of heart attack and stent placement in 2017. His maternal grandmother, she's 69 and has a history of breast cancer, hypothyroidism, and obesity. And maternal grandfather is 72-year-old and has a history of hyperlipidemia and hypothyroidism. AA never met his paternal grandparents, but he knows his paternal grandfather died when his father was 7, and paternal grandmother died at age of 56 due to car accident. Review of system for AA was general. He denies any fever, fatigue, weight loss, or gain. Cardiovascular, he denies any chest pain, palpitation, or syncope. Respiratory, he denies shortness of breath, cough, or wheezing. Musculoskeletal, he denies any swelling, edema of the body and face. Neuro, he denies any headache, blurred vision, seizure, or weakness. Renal and urinary, he denies dysuria, hematuria, or frequency of urination. Endocrine, he denies heat-cold intolerance, polyuria, or polydipsia. Vital signs, the only thing, his blood pressure was elevated above 140, confirmed on repeat, right arm sitting. His BMI is 95% also, it was a high. Physical exam that we performed for AA, general, was alert-oriented, no acute distress. Cardiovascular S1 and S2 present on auscultation, no murmur or gallop. Respiratory, lungs are clear bilaterally, no wheezing or rhonchi. Musculoskeletal, no edema, bruising, or swelling. GI, no severe tenderness noted. No pain in the pelvic area. Neuro, no change in the memory, language, skill, or coordination. The labs, we did the CMP, BUN, and creatinine, electrolytes, fasting glucose, lipid panel, TSH level, and urine analysis. At the moment, we didn't perform any diagnostic testing at the clinic for him. The primary diagnosis for AA was primary hypertension. ICD-10, which most probably is a hypertension due to family history of obesity and lifestyle, but further testing required basically due to we need to perform more blood pressure testing. The differential diagnosis for him was a renal artery stenosis. We can rule out or in this condition after receiving his blood work and urine analysis. This condition also requires more testing. Hypothyroidism, we can also rule in and can increase blood pressure, and we can rule in and rule out this condition due to family history, but rule out for a bit more testing. The other differential diagnosis, substance-induced hypertension, which is the possible hypertension for him also because of using the iliac drugs, the drugs and energy drinks and some stimulating medication. We can rule this condition in for AA since he admitted to drinking energy drink and use of drugs. Well, we need to monitor his blood pressure more closely. Plan for him, diagnostic testing, we're going to consider renal ultrasound. If the renal function and urine, we find that on abnormal finding in the urine analysis. Repeat blood pressure measurement on 3 separate visits. Treatment at the moment, no medication unless its blood pressure is above 160 or symptomatic or evidence of end of organ damage is notified. Otherwise, if we will have to consider ACE or ARB inhibitor, calcium channel blockers, or thiazide possible. Mainly, we need education for this patient. Educations for the risk of hypertension for sure. Emphasize the importance of the healthy diet, reduce salt in the diet, avoid processed food. Importance of the regular exercise and healthy weight, avoid caffeine, energy drink, substance that they can increase the blood pressure, stress management, and need for ongoing monitoring of the hypertension require the lifelike management. Follow up, recheck BP in 1 to 2 weeks with home and school monitoring. Close follow-up with the pediatric nephrology if persistent. Thank you, and